With items from the grocery store, you can naturally whiten your teeth at home. The science supporting these techniques, however, is weak. One survey found that 80% of American individuals between the ages of 18 and 49 desire whiter teeth, and in 2016 Americans reportedly spent more than $1.4 billion on at-home whitening treatments. When it comes to teeth whitening, there are many options to choose. Unfortunately, the majority of teeth whitening treatments employ chemicals to bleach your teeth, which may cause some people concerns. Please like, comment and subscribe for more information on how to stay healthy on our road to 1,000 subscribers. Teeth lose their dazzling, white brilliance and become dull due to a variety of circumstances. Your teeth's enamel, which is their outermost layer, can become stained from some meals. The accumulation of plaque on your teeth can also give them a yellow appearance. Usually, frequent cleaning and whitening procedures can treat this kind of discoloration. Dentin can sometimes be seen behind the hard enamel, giving teeth a yellow appearance. Under the enamel is the naturally yellow, bony dentin tissue. Here are 4 ways to whiten your teeth naturally. 1. Oil pulling. Oil pulling is a conventional treatment that has its roots in India and is intended to enhance oral hygiene and detoxify the body. In order to get rid of bacteria that can form plaque and give your teeth a yellow appearance, the procedure entails swishing oil around in your mouth. Lauric acid, which is known for its capacity to lessen inflammation and destroy bacteria, is also present in large quantities in coconut oil. Daily oil pulling lowers oral bacteria, plaque, and gingivitis, according to a few studies. One of the main types of bacteria in the mouth that create plaque and gingivitis is Streptococcus mutans. According to one study, daily mouthwashing with coconut oil was equally effective at reducing Streptococcus mutans after 2 weeks as an antibiotic mouthwash. Coconut oil pulling does not expose your teeth to acids or other substances that destroy the enamel, in contrast to many other tooth whitening techniques. This indicates that daily use is safe. 2. Baking soda. Because it naturally whitens teeth, baking soda is a common component in commercial toothpaste. It is a gentle abrasive that might assist in cleaning teeth of surface stains. Baking soda also produces an alkaline environment in your mouth that inhibits the growth of bacteria. Your teeth won't become whiter overnight with this treatment, but over time you should see a difference in how they look. While it hasn't been scientifically established, brushing your teeth with simple baking soda can perhaps whiten them, according to a number of studies, while toothpaste containing baking soda can really enhance dental health. According to one study, toothpastes containing baking soda considerably outperformed conventional toothpaste in terms of reducing plaque, gum irritation, and bleeding. Another study found that toothpastes with baking soda may be superior to other toothpastes in their ability to remove stains and whiten teeth. Use the resulting paste to brush your teeth after combining 1 teaspoon, 6 grams, of baking soda with 2 teaspoons of water, 5 milliliters. This can be done a couple times per week. 3. Hydrogen peroxide. A natural whitening agent known as hydrogen peroxide also destroys oral germs. In reality, because hydrogen peroxide has the potential to kill bacteria, humans have been using it to treat wounds for years. Hydrogen peroxide is a common ingredient in commercial whitening solutions, albeit in considerably higher concentrations than you would find at home. Regrettably, no studies have examined the effects of brushing or rinsing with hydrogen peroxide alone. Nevertheless, many studies have examined peroxide containing commercial toothpastes. According to one study, toothpaste with a higher concentration of hydrogen peroxide was superior to toothpaste with a lower concentration for whitening teeth after 12 weeks. Another study discovered that toothpaste containing hydrogen peroxide reduced coffee-related tooth discoloration more effectively than toothpastes containing charcoal or abrasives. Yet, there are some concerns about hydrogen peroxide safety. Although very diluted amounts seem safe, high concentrations or excessive use might irritate the gums and cause dental sensitivity. Although this has not been confirmed, there is also fear that large amounts may cause cancer. Before brushing your teeth, you can use hydrogen peroxide as a mouthwash. To prevent negative effects, make sure you're using a 1.5% or 3% solution. At drugstores, a 3% solution of hydrogen peroxide is the most popular concentration. By combining peroxide and water in equal amounts, this concentration can be easily diluted to 1.5%. Making toothpaste by combining hydrogen peroxide and baking soda is another application for the substance. Brush your teeth with a solution made of 2 teaspoons, 10 milliliters, hydrogen peroxide and 1 teaspoon, 6 grams, baking soda. Use this homemade paste only a few times a week. Otherwise, it could erode the enamel on your teeth. 4. Consume fruits and veggies. The body and teeth may benefit from a diet rich in fruits and vegetables. While they can't replace brushing, crisp, fresh fruits and veggies can aid in removing plaque while you eat. Fruits like strawberries and pineapple have both been linked to teeth whitening claims. Using a strawberry and baking soda paste to whiten your teeth is a home treatment that has gained popularity. According to proponents of this technique, the baking soda will buff away stains while the malic acid in strawberries may lighten tooth discoloration. Yet research hasn't entirely supported this treatment. Strawberries may help exfoliate your teeth, which may make them look whiter, but they won't get rid of the stains on your teeth. In comparison to conventional whitening treatments, a 2015 study indicated that a strawberry and baking soda mixture generated relatively little color change in teeth. Limit your use of this technique to a few times each week if you decide to give it a try. Even while research indicated that a strawberry and baking soda paste had no impact on dental enamel, repeated use could be harmful. To use this cure, crush a fresh strawberry, add baking soda, and then clean your teeth with the concoction. Pineapples are said by some to whiten teeth. According to one study, a gel containing the enzyme bromelain, which is found in pineapples, may be useful for removing teeth stains. There is no proof, though, that consuming pineapples has the same result. The majority of these treatments operate by delicately erasing surface stains from your teeth. Yet, the majority of dentists provide significantly more potent whitening procedures than these home alternatives. These entail whitening the teeth, which might be more successful for severely stained teeth. Any teeth whitening product used excessively can harm your teeth. Always ask your dentist which of your selections would be best for you. Thank you for watching.